Welcome back. Well, summer break has arrived and health experts want to remind parents now is the time to take your child to the doctor. That's because there are important school health requirements for kids. Joining us now with more is Dr. Janet Berryman, the Kauai District Health Officer. Good morning to you, Dr. Berryman.
Good morning. Thank you for having me on.
Thanks for joining us because this is the time where parents need to take their kids to the doctor. Tell us about the importance of school health requirements.
Well, I think I wanted to start by saying that most of the talking that I've been doing publicly recently has been about COVID-19 and about coronavirus. So it's refreshing to get to talk about something else. And I'm also a pediatrician and worked as a pediatrician for many years out at Waianae. So this is really home territory for me to talk about school requirements and prevention and protection of our keiki. So as we get ready to go back to school, it is important that parents take their children to the doctor for a well child checkup. And that really is to make sure that kids are healthy and ready to learn so that they can do well in school. And it's also to keep them from getting sick. And it keeps the kid. Are we having technical difficulties?
Oh, no.
No, okay, sorry. It keeps the children themselves healthy if they're up to date with their immunizations. And equally importantly, it keeps their classmates and their teachers and their families and friends healthy. So we want every child to start the school year healthy and ready to learn so that they can really pay attention and get what they need to get out of their education.
And what are the health requirements for students?
Well, all of the health requirements are available at the Vax to School website, which I think you have and can share with your viewers. But basically, there are two groups of requirements. One is for the first time that children enter school, which is usually in kindergarten, where they need to have a physical exam and they need to be updated with their immunizations. And at that point, they also need to have clearance for tuberculosis to make sure that they don't have tuberculosis and couldn't, spread it to anyone else in the school. And then the new requirement this year is that also students who are entering 7th grade, even though they've been in the school system for a number of years, they also need to have a physical, and there are also some immunization requirements at that stage. So that's the new requirement. But there's no tuberculosis screening needed at 7th grade. It's just the 7th grade immunizations and the physical examination.
So what do parents need to do?
Well, basically, between now and the start of school, and preferably sooner rather than later, they need to get in touch with their usual healthcare provider, call their child's doctor, and say, I want to schedule a back-to-school visit for my child, especially for students who are starting school for the first time or who are going to be entering 7th grade. And they need to bring their school health form to that visit so that their healthcare provider can fill it out and get their child updated on their immunizations. And this is a good time to do it because doctors' offices are open again and doing well child visits. For a while there, when we were having more COVID cases, doctors were really only doing urgent care visits and not as many well child visits. But now things are open and ready for business, and offices have the appropriate precautions in place to keep families and kids safe when they do come to the doctor. And time is of the essence because the school year starts in early August, and a lot of kids are going to need to have their physicals and immunizations. So the most important thing parents can do is call their doctor's office and make that appointment.
Yes, and don't wait. Make that call today. Thank you so much, Dr. Berryman, for joining us and for those reminders.
Sure. Thank you. You're very welcome.